first came to MacNeal in 1995, I had a full head of hair. Now I'm getting an AARP card in the mail. Dr. Kinder saw me in the hallway, offered to put in a pacemaker. But during the last 2 years of my career, it's really been a privilege to be the president. I took my work as a doctor's advocate very seriously, and I've given input on all hospital matters from the doctor's point of view. So now I'd like to give my State of the Hospital report. The stairwell no longer leaks. That's kind of a mundane observation, but I think it reflects all the work Mr. Lemon and his team has done to bring things back to working order. We welcome the new flooring, the new paint, and the plans for many more computers on the patient's floors. In the last year, the Medical Executive Committee has reviewed 100 applications for positions on the medical staff, and there are multiple quality improvement projects going on at MacNeal as we adapt to ever-increasing regulations and guidelines. The date of pay for performance is upon us. Medicare and other payers are switching to a payment system based on outcome measures, not on just how much time we spend with the patients. And there are ongoing QI projects that we have going. They're really the only way to adapt to these new regulations and systems of payment. I encourage every single doctor here to take part in at least one quality improvement project or one committee. We can't have Chuck Ferris do everything for us. And medical errors, they can't be swept under the rug anymore. We have to learn from these and improve our process. Take a look at these orders. Can anyone tell what they are? You know, I'm the first to say I don't like some of the disapproved abbreviations by JACO, but this is just dangerous. This can't be read. The nurses can tell you they can't figure these out, and this is just dangerous. What's our #1 medical error at MacNeal? Anyone pick it out on this? I know it's a little hard to read. And any volunteers? #1 medical error? Chuck, you got to pick it up. No patient name in the corner. Dr. Levy wins the prize. That's the #1 medical error. It's the pharmacy getting an order sheet without the sticker on it. And it's a simple thing to fix, but we have to remember to look for it if we're going to do that. We need everyone's help to participate in curing medical errors. The coming years hold many challenges. One that faces the medical staff will be how to credential doctors who no longer come to the hospital and have their inpatients seen by the hospitalists. Reimbursement is going to be tight, regulations are going to multiply, but our patients, and especially our aging population, are going to need it more than ever. President Obama, and in this week's Archives of Internal Medicine, they want us all to switch to computerized medical records, and we all need to rise to these challenges. During the last 2 years, the hospital has purchased the MRI center so that an inpatient MRI will be realized. The PLC committee has recently been created to allow camaraderie and exchange between the doctors and administration and Vanguard Corporate. Janice Weiner has taken on the tough task of improving utilization. And we have new forms of blood transfusions, and we have new academic affiliations coming up in the upcoming year. $10,000 of the medical staff funds have been pledged to the videotaping of our own CME programs for equipment and training, so that CME programs done at MacNeal will be available for us on the intranet if we can't attend them in person, so you can still get CME credit. During my tenure, the hospital has had the honor of multiple 5-star ratings from Health Grades. In addition, tonight, I'd like to bestow a 5-star rating on Betty and the medical staff office for all of the patients. This job would be impossible without them, and Brian Walton is about to learn that. In conclusion, I'm an Eagle Scout. And I believe it is the leadership qualities I learned in scouting that resulted in my election to this position. I recently read this book, Susan Balter's book, by the way, by Randy Couch in his book, The Last Lecture. He conveys in here what is different about Eagle Scouts, and it really rang true to me. So I'm going to quote from him, quote, "When I think of someone who's earnest, I think of a Boy Scout who works hard and becomes an Eagle Scout. When I was interviewing people to work for me, I came upon a candidate who had been an Eagle Scout. I'd almost always tried to hire him. I knew there had to be an earnestness about him that outweighed any superficial urges towards hipness. Think about it. Becoming an Eagle Scout is the only thing thing you can put on your resume at age 50 that you did at age 14. Now, although Randy didn't know about the equivalent Girl Scout Gold Award, the quote rings true with me. I'm 50 years old and I made Eagle at age 14. So really, thank you all for living up to the opportunity to live up to this ideal. Thank you. So next up we have Brian Lemon for the CEO report.